Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Aggrieved members of the Nigerian Medical Association Imo State Chapter make passionate plea to the state government for the settlement of 7-month salary arrears. Yobe State Sustainable Development Goal Program empowers 850 women in local food production to cushion the adverse effects of COVID-19 in the state. And COVID-19 infections around the globe continues to surge as number of infected cases, rather deaths, surpass 1 million. While almost 50,000 people have recovered from the coronavirus in Nigeria, the country recorded 3 deaths in 24 hours, putting the total at 1,111. The Nigeria Center for Disease Control reported 136 new cases, reported from 12 states and the Federal Capital Territory, with Lagos State leading at 71 cases, followed by Rivers 23. Plateau State recorded 12 cases, Adamawa 6 in Oyo as well, 5 in Kaduna, 3 in Abia, 3 also in the Federal Capital Territory, and 2 each in Katsina, Kwara. Bauchi recorded 1 case, so did Borno and Edo states, respectively. Lagos, Nigeria's commercial city, is Nigeria's COVID-19 hotspot with over 19,000 infections since the first outbreak and 205 deaths. Currently, it has 3,859 people on admission. Abuja, Nigeria's capital, is the second most impacted, with a total confirmed cases of 5,677 cases, and it has recorded 77 deaths. 795 patients are currently receiving treatment in the FCT. In the past 3 weeks, Nigeria has not reported any daily infection above 300 since August the 23rd. One of the highest cases was recorded July the 1st, when 790 cases were reported. With cases falling, is it an indication that the country may have passed the worst stage of the virus pandemic? Well, according to the Presidential Task Force on COVID-19, it is important that we remain cautious, as non-adherence to COVID-19 protocols can lead to an increase in infections. In the meantime, the NCDC says it remains committed to providing technical supports to states for the implementation of COVID-19 activities. The team is conducting trainings on COVID-19 infection prevention and control measures for over 1,000 community healthcare workers and proprietary patent medicine vendors from 14 local government areas across the country. In the meantime, in Africa, over 1.4 million confirmed COVID-19 cases have been recorded on the continent, with more than 1.1 million recoveries and over 35,000 deaths. South Africa last night reported 903 new cases, with its total cases at over 670,000, cumulative cases representing about 57.32% of all the cases in the region. Now, the virus attack rate is of 1,184.65 per 100,000 population in the country. The latest deaths recorded there were about 188, and it has a case fatality ratio of 2.47%. In the meantime, 90% of the cumulative cases have recovered. It has 50,605 cases that are active. Now, the second highest, and this is according to the World Health Organization Africa region, is Ethiopia. And Ethiopia has 73,944 confirmed coronavirus cases. The country reported 612 new cases and has 6.31% of all the cases in the Africa region. And the virus attack is of 65.53 per 100,000 population. Now, the death fatality ratio is at 1.59%. The country is currently managing 42,014 active cases. Now, is another industrial action looming in the health sector? This is as the Nigerian Medical Association in Imo State. They're appealing to the Imo State government as a matter of urgency to commence the payment of 7 months' salary arrears owed its members working at the Imo State Teaching Hospital, Olu. Briefing newsmen at the association's headquarters in Owerri, the state capital. The chairman of the association, Mr. Chidebere Okpara, says there is need to pay up all monies owed to prevent any form of industrial disharmony at the center. He also appeals to the state government to ensure the implementation of the revised Consolidated Medical Salary Circular 2014 without further delay.
We do hope and we plead on His Excellency, being the father of the state, to use his goodwill. We know he has the capacity. We know he has the welfare of the people of Imo State at hand. We know he has the welfare of the medical practitioners, the welfare of all the other workers in the health sector in mind. That is why we are pleading with him to implement the revised Consolidated Medical Salary Structure 2014 circular with proper placement of doctor with effect from October 1. We consider that this implementation of this salary structure is the best gift His Excellency can give to the health sector. The implementation of that salary structure across the health institutions in Imo State, the ministries, the departments and agencies of government in Imo State is very crucial to deliver very good health care system to the state.
To mitigate the effects of COVID-19 pandemic in Yobe State, the government, through its agency Sustainable Development Goals, is empowering 850 vulnerable women across the 17 local government areas in processing local spaghetti. Starter packs cash were presented to beneficiaries in Damagum, the headquarters of Fune Local Government Council, where the coordinator of the SDG, Musa Damagum, charged them to make good use of the opportunity provided. The vulnerable women, mostly widows whose husbands were killed by Boko Haram insurgents, were also empowered to improve their livelihood.
We are trying to respond to the poverty gap that the state now faces at 62%, and then the state government is trying to come up with a response. We are hoping to expand to other local governments, but for now we targeted 50 women, 50 women in Fune local government. So we are still hoping to also expand to other local governments.
Honestly speaking, these women you are seeing here are the most vulnerable women in the community of Damagum, and that this gesture is going to cut across the local government. We are just flagging off in Damagum because of the fact that it is the local government headquarters of Fune local government. And Fune local government, being it the largest in the whole of Northeast, created since 1976 criteria, and that, of course, is going to cut across the local government.
Over in Niger State, the government has announced that all schools in the state will reopen on the 4th of October for third term 2019-2020 academic session. The decision was reached at the end of a stakeholders meeting at the State Ministry of Education in Minna. This is coming after months of schools closure due to the outbreak of COVID-19. Our correspondent Emperor Simon brings us this update.
The State's Commissioner for Education announced the reopening of schools after a stakeholders meeting that was held at the State Ministry for Education in Minna. She says the decision was reached after due consultations with all the stakeholders.
As a state, we adopted the following resolutions for the purpose of the safe reopening of schools. 1. That all teachers are to return to their respective schools from 29 September 2020 to commence preparation for the reopening. 2. The reopening of all basic and post-basic classes of public and private institutions for third term 2019-2020 academic year starts from 4th October 2020, with the exception of public boarding schools where only SS2 would resume on the same day using the platoon model.
Some of the participants at the meeting, including those from the private schools, say they are happy with the decision and they hope to maintain all the safety protocols that have been put in place.
There are many that have been going on talking about admission forms are on sales and adverts. Definitely they just have to stop that as far as Niger State is concerned, so that we'll comply with the new academic calendar. And I hope hopefully by 2021, it's going to be centralized with all other states and we'll have a uniform calendar.
We are very much happy and very pleased to ensure that we deliver the best services for the parents.
Niger State at the moment has a total confirmed positive cases of COVID-19 at 257. And one wonders what will happen when schools reopen come 4th of October. Emperor Simon for COVID-19 updates.
Joining us for more on flattening the COVID-19 curve is Dr. Anire Chimaduko. She's a public health physician. She joins us here in Lagos. Thank you for joining us on the program.
Thank you for having me.
All right, I'd like to begin from Lagos, where we are, and this is with regards to the NTD's figures last night that showed Lagos with 70 cases. Some people are saying it's an uptick from the number of cases Lagos has recorded in the last couple of days. Why do you think this is?
This could be as a result of many factors. It could be as a result of more people coming forward to test and many other things that we are not aware of. So I think it's still early to conclude. We should watch the trend coming for the following days before we can conclusively say that there's an increase.
Now, some people have said that those that have survived COVID-19 are still being stigmatized, and with this ongoing, it's discouraging people to present themselves for testing. Do you think that this is true? I mean, is this something that you've noticed in the hospital?
Not that I know of, really. Right now, COVID-19 is general knowledge. Everybody's aware. And you know how we Nigerians know how to make fun of everything, and people are even laughing about it. I've been seeing posters of Uncle Koro must go and things like that. So yes, people know. I don't think the stigma is that bad. So I don't think it's enough to deter people. But I also feel that there are a lot of asymptomatic carriers. And because they're asymptomatic, they may not feel the need to come forward for testing if they are feeling okay in their homes. So there's no severe, people with asymptomatic or maybe mild cases may not feel ill enough to come forward for testing. So
it's a lot of more enlightenment and awareness, especially for young people who look like they don't have it, but then they're actually carrying it.
Yes.
In terms of the non-pharmaceutical protocols, are we seeing more compliance from the beginning, or now that it looks like the numbers are coming down, less and less people are complying?
To be honest, I think there's less compliance. People are going back to business as usual. So I'm happy that we need to continue sensitizing them on the presence of the virus. Another thing that is also making the compliance low is the fact that it was not as we expected. A lot of people expected more in terms of deaths, in terms of illness. This is really not what we expected. So most people feel, okay, even if I have it, it might not be that bad. People are not dying on the streets. So that's maybe why the compliance is not as it should.
So in terms of perhaps what people need to know now, what would you say to them, especially with regards to leaving their homes? I mean, schools are opening up, businesses are also have opened up as well, going to the markets. You know, how much responsibility should they be taking? Okay,
right now I think the responsibility lies on the individual. The government has played its part. I think our response, the Lagos State government, the Nigerian government has done a lot to support people and respond to this pandemic. So it now lies on individuals to follow the safety measures that has been stipulated in terms of using a face mask, having your hand sanitizer, washing your hands, practicing respiratory etiquette and the likes. So that is what we need to do and be on our guard.
All right, we appreciate your time. Thank you so much. We've been talking to Dr. Anire Chimaduko. Thank you for joining us on the program.
Thank you for having me.
We'll have more on the COVID-19 updates when we return. Please stay with us. Welcome back. Despite the challenges posed by the COVID-19 to the educational system in Delta State, the need for teachers' capacity to be constantly built to enable them keep abreast of the modern trends has become very important. Now, over 1,000 newly recruited teachers have now been inducted into a training program that will equip them with the necessary knowledge to help them discharge their duties in these times.
Part of the reason we went into this recruitment exercise was that it was beginning to seem like we had a dearth of teachers, especially in rural areas. And so the mindset was that we are recruiting teachers that are going to serve and teach in schools in the rural areas. And this will happen for a minimum of 5 years. Remember, you did not get employed because you knew the governor or you knew the commissioner or you knew the deputy governor or anybody in the high place. You got recruited purely on merit. So it's the same attitude and the same mindset that is going to be expected of you when you start working. Please don't go running to anybody to say, oh, I don't like where I'm posted. I want to come to the organ because that's not why we're recruited. For a minimum of 5 years, you're going to have to do that. You're going to have to get the feel and taste of.
Dr. Amina Ahmed is a public health physician and she joins us here in Lagos. Thank you for joining us on the program.
Thank you very much.
All right, looking at flattening the curve, schools opening up, teachers preparing for the new normal, as they, of course, study and teach. We're hearing that from states like the US, there were a number of students, pupils that contracted COVID-19 and that the ages of 12 to 17 are as much likely to get it as also age 5 to 11. Now, in our efforts at the response at flattening the curve, do you think that there is still that fear? Or are we looking at the cases we're getting, which seems to be lower on the one hand, and this is also across countries in Africa that seem to be recording lower cases, and if we can say that we're actually close to flatten the curve? Because on the other hand, you have the government saying that we're not testing as much as we should be.
Thank you very much for that question. Actually, the COVID-19 cases that we're having, the most common age range that have COVID-19 from the research that has been carried out is between ages 31 to 40 years of age, so falls within the young people. But then when you have, like you said earlier, the cases where you have ages between 5 and 7, and then you have 11 and above having COVID-19, yes, it's very possible. They could have it, but the thing that has been noticed in them is that they don't really, they are mostly asymptomatic. But the fear that we're actually looking at is the fact that they could have it, they could be asymptomatic, but they would take it back home, where they have older ones at home. They have probably parents or grandparents who have underlying diseases that could actually contract this COVID-19 from the children. And that's where the fear is. So if they don't exercise the non-pharmaceutical interventions that are supposed to be done in schools and in the community at large, then we still have a fallback on people at home who unnecessarily didn't go out to get the COVID, but the COVID came back to meet them at home.
So in terms of protecting the children, the immune system has a lot to play in this. Tell us a bit more about COVID-19 and how it attacks the immune system.
Well, the issue with COVID-19 is it's a viral disease, so it affects the immune system as the other coronaviruses. This particular coronavirus is SARS-CoV-2 virus. So it actually depletes the immune system for a while, but it's not as bad as what you have with HIV. But then what you have with this particular one is that when it meets a depressed immunity state, it actually affects the person more. So the person is more symptomatic, and if there's an underlying disease, perhaps maybe diabetes, hypertension, and others, the person seems to be more symptomatic, perhaps even have more complications than when it's contracts, when it affects another person that doesn't have underlying diseases. So you have, they're looking at a possibility just like measles and polio, where you have herd immunity with these particular viruses. But COVID-19 we haven't been able to reach that yet. The possibility of herd immunity would only come when at least about 70% of the population is affected with COVID, and then you now look at the possibility of having a herd immunity. And that we can't wait for that. If we want people to have that, you would have to wait for everyone to get infected, which would affect them eventually. The collateral damage is probably going to be more than the infection itself. So the only thing that will probably make us to get to that point is having a vaccine, which is still in the works. And perhaps the first time we're going to have one would be maybe in 2021, if we're able to get one.
Finally, in strengthening our immunity, especially, as the children, attend school, what should we be doing?
Of course, for children going to school, strengthen their immunity, it has to start from the home. All right, so they have to be from their feeding, from all the things that they carry out in the home, because a lot of things wound around immunity. Okay, so the child has to be well fed, has to be properly, fed, properly protected enough to be able to go to school. The parents have their own parts to play, because when these children resume school, the teachers will do theirs, the guidelines are there, but the parents on their own have to prevent these children from having other diseases that would make them more depressed, that would expose them further to having COVID when they go out of home. So teaching them how to protect themselves, wash their hands properly, proper hand hygiene, respiratory etiquette, the social distancing, which is very difficult in children anyway because of physical meeting in school and all of that, and wearing of masks. That is also very difficult with children, but they have to learn it. So that has to be taught both at home and in school, so that this can be prevented amongst children.
All right, we'd like to thank you. We appreciate your time on the program, Dr. Amina Ahmed, public health physician. Thank you for joining us.
Thank you very much. Thanks for having me.
The world marks a grim milestone as more than 1 million people have died from COVID-19. The UN Secretary General Antonio Guterres calls the number mind-numbing, stressing the need for all nations to work together against the virus.
As the COVID-19 virus has killed more than 1 million people around the globe, the US remains a country with both the most reported infections and the highest number of deaths. Brazil has the second highest number of recorded deaths, followed by India, Mexico, and the UK.
Of the United States, accompanied by the Vice President.
Under pressure over his handling of the coronavirus outbreak, U.S. President Donald Trump says that the government will distribute millions of rapid tests to states this week, with an eye towards using them to reopen schools.
Today, I'm pleased to report that we're announcing our plan to distribute 150 million Abbott rapid point-of-care tests in the coming weeks, very, very soon. This will be more than double the number of tests already performed.
President Trump is trying to show progress in the battle against the new coronavirus as he fights for re-election in his November 3rd matchup against the Democrats, Joe Biden. Meanwhile, scientists continue to work towards a vaccine, with 9 potential vaccines already in the final stage of testing. Although there are no vaccines proven to protect the body against the disease, there are around 40 different coronavirus vaccines in clinical trials, including one being developed by the University of Oxford that is already in an advanced stage of testing. Finally, Chile's capital, Santiago, has lifted almost all of its restrictions after 7 months of lockdown, making it one of the longest quarantines in the world. 8 communes of Santiago have reopened economic activities. However, Chile remains a nighttime curfew under a state of emergency order in place until December 15.
And you can take a closer look at some of the updates on COVID-19 in real time. Visit our website. It's channelstv.com. There you get a better understanding of some of the trends on COVID-19 and other stories as well at your fingertips. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.